Okay. Good afternoon. I am Crystal Nicole Donovan, and we're going to spend just a few minutes talking about justice, equity, and psychosis. I do want to inform you that it is LGBTQ Health Awareness Week. Here at the Best Center, we are focused on the integration of psychiatry and primary care, which also includes sexual health. So if you are interested, you can go to the website listed at the bottom. Our objectives for today are identify saneism, define disability, and identify a few action steps. As I was preparing for this presentation, I'll be honest, I started to take justice out of the title of the didactic. Justice isn't something we're necessarily going to achieve today. However, I did remember that justice is aspirational. And so I decided to keep it in front of me and to remember that it is always the goal. I also thought about this quote from Dr. Martin Luther King Jr. The anniversary of his assassination is quickly approaching, and I know many people will be quoting Dr. King, but this is one of my favorite quotes. Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all directly. Before we move forward, I'm going to tell you a brief story. When I first started in mental health, it was all new. So after school, I was working in an organization that had a different focus. So there had been some discussion about diagnosis and interventions in school, but I was really in a place where I just wanted to be a sponge. So I would sit in all the appointments with individuals' permission, of course, and was just trying to learn all I can. And so I was sitting in with one psychiatrist who has since transitioned, and he is with the ancestors now. And at the end of the appointment, after the individual left, he started talking about my little angels. And initially, I wasn't sure who he was talking about. And I realized he was talking about the individual that just left and other patients, as he called them. And so again, I'm new and I hear this and I just think, this is interesting. But then I hear it again and I hear it again and I hear it again. And I just became uncomfortable. I know his intentions were good, but it just did not sit well. But I also knew it was something else, that it was more than just my feelings, that it was something bigger than Crystal, but I couldn't just quite put my finger on it or articulate the bigger concept. And then someone started talking years later about saneism. And I realized this was it. Saneism consists of prejudicial attitudes towards people with mental illness. And I want to stress that it could be someone with a mental health diagnosis or the perception that someone has a mental illness. So one doesn't necessarily have to have a diagnosis to be on the receiving end of saneism. And saneism exists on a continuum. It is compounded when it's experienced by individuals that have been pushed to the margins, such as we think about our Black and Latinx participants and/or our participants from the LGBTQ community. And some of the characteristics, again, all of a sudden started making sense when you look at considering one to be inferior, childlike, competent, violent, or even in some situations dangerous, simply based on a mental health diagnosis or the perception of a mental health diagnosis. As I was learning more about saneism, I also was hearing people talk more about disability and talk about it in different ways. And prior to this didactic, we were talking a little bit about Social Security and how they define disability. And we won't get into the weeds, but essentially, disability is looking at whether individuals can engage or not engage in what they call substantial gainful activity. And there's levels of work activity. So one could be considered disabled, but maybe work just very limited hours. So again, if you're interested, want to know more, there's the link. But as I said, as I continue to engage with individuals, to be in a position where I'm actually listening and learning, they started to tell me that disability isn't necessarily a bad word. According to the social model, disability is the inability to participate fully in home or community life. So essentially, it's not about the individual, it's about the limitations or impairments or the physical and social barriers that, again, prohibit someone to fully engage in home, work, school, or their community. And so for those that identify as disabled, they are calling for an end to discrimination and oppression against people like them living with a disability. And they're hoping that that will happen through education, accommodations, and what they call universal design. And what I definitely believe in education and awareness, also want to stress that, moving beyond just the education and start thinking about action steps such as like implementing accessibility options for those that need them. And I'm going to read this quote because it reminded me of the first quote by Dr. King. To eliminate disability is to eliminate the possibility of discovering alternative ways of being in the world, to foreclose the possibility to recognizing and valuing our interdependence. But there are reasons, as we know, that people might want to avoid labels. They might want to avoid the label of psychosis, avoid the label of disability. Psychosis has been and continues to be one of the most highly stigmatized conditions. And I would even push back on the perceived discrimination. Actual discrimination continues to be a barrier to care. But I also want to highlight that young adults in coordinated specialty care programs just might not want to use labels. As we think about shared decision making and self-determination, again, many people in coordinated specialty care, their focus is education, employment, and relationships. So wanting to simply move beyond the label is okay as well. And we've shared this before, but it's still relevant. We also want to just think about interpretation. So this was a presentation at a Native American charter school in New Mexico, and it was an early psychosis program, and they were doing outreach. We've been talking about outreach a lot lately, and they were describing all the signs and symptoms of psychosis. And someone interrupted and said, well, you just described a medicine person in my culture. And so again, as we're thinking about psychosis, label disability, disabled, not disabled, just a reminder that we definitely want to have some cultural sensitivity and thinking about interpretation as we are having this conversation. And also just remembering that more than one thing can be true. So as I was, in a place of listening and people were talking about saneism, again, it's recognizing that people are going to have a range of experiences. So if we think about a participant that is working and maybe they hadn't been working, and so the experience of working was all new and they get into position and they're doing well, thinking about conversations, being open to conversations about lateral moves or, even moving beyond that, considering, are they going to be able to move up in this particular organization or business? Or are we just confining them. I think the one thing we do not want to do is just confine them to one position. So you only can work here. We want to encourage our participants, they're open. We want them to think bigger. But also on the other end is the participant on my right. It might be someone that simply at this point does not want to work. So maybe they moved out of crisis and they want to reestablish relationships. Maybe the relationships were in shambles and they really just want to work on the relationships. Maybe there's some other things going on with their health, but just really want to start integrating themselves back into the community. And what I have learned is even when someone has this position and is trying to stand firm in that position, that it can be a struggle for them. Because again, people might not consider them as productive. And so they can be easily excluded from the community that they're actually trying to engage in. But I'm going to leave you with just a few little action steps because, again, we want to move beyond just awareness and actually start thinking about what are some just practical, everyday things that we can do to address saneism. Flattening the hierarchy was essentially it's just cultural humility. So if we think about, how do we explore inequity and discrimination? So again, maybe someone like wanting to move out of the job and, not necessarily members on the team, but maybe their coworkers or their supervisor is not, presenting opportunities to maybe move, laterally. So again, or move, kind of not allowing them to start thinking about upper mobility and start thinking about ways that we're able to address that through just, routine supervision, consultation, if you're in a team leader role, or during your routine meetings with the coordinated specialty care participant. Doing our own homework is important. So I talk about Adilsa Ferdinand often in different places. Adilsa experienced their first episode of psychosis when they were in college, but Adilsa talks about how saneism contributed to the erasure of other parts of themselves. And so Adilsa was in a place where they were seeking help and, they wanted to be able to get through the semester. So they were seeking help, therapy, trying to identify coping skills. But according to Adilsa, people were asking them, what does it mean to be Latinx? Or are you sure you are non-binary? And Adilsa believes that they wouldn't necessarily have gotten those questions if it wasn't for the saneism. So as a result, you think about original going back to the definition, it is the discrimination, the discriminatory beliefs, but then the characteristics of one being childlike and incompetent. I do always want to tell people that Adilsa did push through. They talk about finding community through their peers, support, and community through their peers. And they ultimately graduated magna cum laude. And then that self-evaluation and critique, that lifelong self-evaluation and critique, which again is just old school cultural humility. It was not planned, but I actually listened to a panel that was discussing saneism on Tuesday. And the panel was a group of individuals with lived experience. And one of the participants talked about like the ability or the saneism in all of us and how they have even experienced internal saneism. So he was talking to essentially what felt like me, but individuals in the audience, that it's not about just wanting that knee-jerk reaction that, no, I'm not sanest. It's really about how do I unpack my own sanest beliefs, especially, as I discussed earlier, when oftentimes one's value is connected to how productive they are. So really, I'll be honest, that just happened Tuesday. I am still unpacking all of that. But also, to be honest, I recognize that I myself have some work to do. And so just want to share some everyday actions for me. I wouldn't ask you to do anything that I wouldn't do. The learning about the mental health experience is different than learning about mental health. And so again, being in a place where I can sit and learn and listen. The middle, supporting the reclamation of pejorative language, it's that stood out as someone kind of when I have these multiple identities where people have attempted to use language to harm. I definitely can understand individuals wanting to reclaim that language. And then, as I discussed earlier as well, just, how do we support alternative methods of expression so we're not just putting participants in the box and, all of us are just really thinking bigger. I want to thank you as always for being here, for listening. And this concludes our didactic for this afternoon.